may not respond the same way that this patient responded. Strong, with good amount of antibodies, in a very safe way. And some other patients may go through a full process of inflammation. So why exposing yourself to be, boosted by the infection itself? So some patients, it's better that they get boosted by a controlled setting, like getting another vaccine. I do not think that that's where the solution for the big numbers of infections rely. I don't think that they rely on the boosting. I think that they rely on getting vaccinated if you have not got COVID. That's where it relies that seeing the high numbers. Because Alabama, before we started seeing Delta variants, had a high 30s, early low 40s excuse me, vaccination rates. So we have, probably 40%, excuse me, 40% of people that has never been exposed to the virus. So this is the situation in which we are. We are getting very, very busy in central Alabama. Other states cannot get their units with enough nurses or enough personnel to get the units running to hold all these people with COVID-19, calling here and there to get the patients transferred. And every hospital is full. So we really, really need to get this to a better situation. There may be some situations that cannot be avoided anymore at this point. So if you are not vaccinated, if you haven't had COVID and you're not vaccinated, get vaccinated. It will save a lot of problems. So that's the situation in which we are. I think that we have some questions in the set.
Yeah. How long do you, and thanks, you're doing a great job covering the virus for us. How long after someone had the virus that they can get the shot? My sons had it during June. My family did. They had the virus during June. And now, when can they get the vaccine? The vaccine?
Well, when is that question is kind of it's a permissive question. It's like, when can be done? It can be done 2 weeks after the patient has got the vaccine. But I think that that's like one of those questions in which a one-to-one discussion in the specifics of the case should be done. If you ask me, how is that I determine if a person that has had COVID when to vaccinate, I would say that I will test for antibodies and see when the antibodies fail to give a booster. I will give one booster only to that person when the antibodies fail. So the against that virus for several weeks or several months. So the way that the body will maintain those, and if they are used, if the antibodies are used, they will keep being produced in the body. Meaning if the patient gets re-exposed, you know, it will continue to or maintain those antibodies. But if the body does not get re-exposed to that virus, it will definitely reduce the production of those antibodies. That happens after 3 to 6 months, depending on the re-exposure. So what I will do in that situation in your son is I will measure the antibodies, you know, frequently, and if they fail, you know, give one booster at that time. You know, you could do it without knowing anything at 2 weeks, but I don't think that that is necessary. The immunity of the own immunity of the body will be maintained for several weeks or months, and you know, getting the test every 4 weeks will be something that I will do to determine when to boost that person. And I think that that will be my own assessment for those persons, for those patients that are immunocompromised, looking for a third dose, you know, that's what I will do. I will look for antibodies in the blood. It's a serology, it's a blood test. That's what I will do. I will look for those, and then after a certain amount of, if you ask me time-wise without doing the test, I would say that I will do it after 4 to 6 months without any test, you know, kind of thinking. But if it would be a more informed decision if the antibodies are measured in blood.
And we hear, you know, you get a lot of stuff, and I hate to say, because I know y'all don't like us to talk about what we hear on the internet, but how are we protected? People are saying, you know, you take alcohol swabs and go up under your nose. Is there any protection to that when you do that?
For the virus?
Yeah, when you wipe up under your nose with the alcohol pads. How much protection does that give us from the virus?
Well, if it's in there and it's going on its way and you wipe it, I mean, you can. It's like washing your hands. That is as the same as washing your hands. You know, meaning wiping your nose or cleaning your nose from. But you cannot do that all day long. You know, to protect. It's not that you use one alcohol wipe and that it will get you protection for days or hours. You know, it's just on the moment. It's a pinpoint moment solution or cleaning. You know, it's like cleaning your hands once a day. If you're exposed multiple times, you will need constant, you know, wiping. I think all the preventive measures that we learn for the wild type, they work, but they work with a limitation. And we all have learned that the preventive measures as masks, face covers, washing your hands, that they are limited, that we are not 100% compliant with that measurement, that we feel safe with a specific people of getting, you know, our protective equipment down or to the level of the nose. So those protective equipment work well if you follow them 100%. don't, it lowers that possibility. I do not think that the way we use the protective equipment like masks, the way we're using it for the wild type virus, the initial virus, will work as well as with these more aggressive variants that transmit faster. So remember when I said that when I'm talking to somebody that I say, if you didn't get your vaccination, the Delta variant is going to find you, it's because of that. Because if you didn't get infected before, or you didn't get your vaccination, and you're exposed to a minimal burden of virus, it will get you. It will get to you. So this virus is way more efficient on looking for all those, misuse of masks and washing hands or face covers. It's happening. It's just going everywhere. In the places that it never touches, it's now rampant. Any other questions?
Yeah, I have this one. You remember before I was telling you about the antibody, I'm not gonna say it right, but antibody, that's in my body, and I already had my 2 shots,
Mm-hmm.
but I still sometimes still have to go back and get the blood transfusion, and they said that's the reason they take so long to make my blood, because it take a day or so, or maybe longer to make it up. I just went, I think about 3 weeks ago, and I had to have another one. So did that, by me getting them, do that help me a lot, or it's against, with the virus?
So,
I
meaning
had my shots.
that you're getting transfusions?
Yeah.
So the question is, will I have got my shots, and for a specific condition, I have to get blood transfusions,
My blood get low,
mhm. And if the blood that comes has antibodies, will that help my body? There was a big study from Mayo Clinic about plasma transfusion. They will get blood products of people who has recovered from COVID and give it to the people that had COVID in the moment to see if they recover. And it didn't work. That getting the blood and giving it to somebody, the amount of blood and the amount of antibody or whatever it was the reason, it didn't work in transfusions in one dose. But what it has worked is, which is one of the current treatments, is getting the blood of somebody who has had COVID and has recovered from COVID, analyzing the blood, getting to the pieces that are the antibodies, and looking at it and saying which of those antibodies that are here is the one that neutralizes the virus. And they have identified that antibody, and they have separated in the lab that antibody from the plasma or blood product and put it in front and say, this is the antibody that works. This is what we need. We don't need the whole transfusion. We don't need the plasma. We just need this. And they have gone to another lab where they can produce proteins, and they have replicated this antibody, this one antibody, they have replicated and make a batch in a solution of that antibody that works against the virus, that neutralizes the virus. That is called monoclonal antibodies. Mono means one, clonal, it means that you have cloned one antibody, the one that neutralizes the virus. is an infusion. So currently, what you do is allergies in Montgomery. What you do is, if somebody gets tested for COVID positive, and it's more than 55 years old, or it has a weight, is obese, has a body mass index, a BMI more than 30% in large, are pregnant, or have any comorbidities like CHF, COPD, congestive heart failure, chronic obstructive pulmonary disease, coronary artery heart disease, liver disease, any comorbidity, and they are more than 40 kilos or 100 pounds, and more than 12 years old, if it qualifies with those, and it's not on oxygen, that person qualifies for that type of treatment, the monoclonal antibody. And there are several infusion centers here. Certainly, the Baptist system has an infusion treatment center in Normandy Drive. The doctor has to send you with an order. But any person above 55 years old, or that is pregnant, or that is overweight, or that has a comorbidity, could get treatment with those monoclonal antibodies, and they work. They prevent severe disease and or death. So those monoclonal antibodies work. And if you are a physician, primary care, or a specialist, if you have a patient that is not hypoxic, and is more than 55, obese, heart disease, liver disease, or lung disease, or immunocompromised of any way, send them with an order to get monoclonal antibodies. So if you're a provider, please do that. Do not wait until the patient has hypoxia or needs oxygen, because it's not indicated at that moment. It is not indicated, and the outcomes are worse in those patients than in the patients that are not hypoxic. So the blood transfusion, no. Proper antibodies monoclonal antibodies will be a better fit for treatment. Any other questions? Are we running out of time, Pastor Michael?
What about the people that are vaccinated and still end up with the virus?
Mm-hmm. So we have a question. What about the people that get the vaccine and end up having the virus? So we were explaining earlier that there are different situations. Vaccines are not 100% effective. There is some people that will not get the full effect, or any effect at all. And there is some people that will get partial effect. Or there are some people that got the effect for a certain amount of time, and now their body has wear out the antibodies, and when they get reinfected, the virus is so fast that, when they are trying to wake up their immune system, they get sick, and there's an inflammatory process. That's called breakthrough. But breakthrough is not the common situation. Breakthrough is the exception. The majority of the patients that we are seeing are patients that are not vaccinated. But yes, there will be some breakthrough. And hopefully, if they have the vaccine, their case will not be as severe or lethal. But it happens. The vaccine was never 100%, You know, the best vaccine was 93, 94%. And with this Delta virus, if you get the vaccine, it's like, depending on the vaccine you get, is 70% or 80, 70 plus or 80 plus. It is not perfect. So it can happen, even if you were protected at some point. But your case will be less severe and hopefully not end up on a lethal case. But it does happen. But again, those are the less amount of cases that we're seeing. What we're seeing is the majority of the cases of people that are not vaccinated. Any other questions?
Let me ask one more. What about the kids that's on, say, they can have a shot so they're 2 years old? So if they, can they catch it?
Okay. So the question is, what about the kids that cannot get the vaccine? So the goal of vaccination is to avoid severe illness, hospitalizations, or death. So the people that are more vulnerable to those outcomes are the adults, and they were the older adults the more vulnerable. That's why we started by cohorts when we started vaccination. We started the vaccination of older adults because they were the more vulnerable for this infection. And the vaccine was tested for adults. Nowadays, the vaccine has been approved up to 12 years old. So kids, teenagers that are 12 or more can get the vaccine. The vaccine is getting tested for lower than 12 years old. It doesn't mean that they do not get infected or they do not transmit the disease. They do get infected, and actually they do transmit the disease. But there is something that is that has been well studied with the wild type virus, with the initial virus. Kids below 12 years old do not transmit the illness as much as 12 years old or more. So the virus is more transmissible above teenage years because of different physiological changes of the strength of our throat, the way they sneeze, the way they cough, versus how much kids below 12 can transmit. They say that is the puber changes what makes that differentiation. But certainly kids do get, kids below 12 get COVID and can transmit COVID. But their cases are not as severe as the cases on adults. Somebody will come out and say, Dr. Reyes, you have not read about those kids that have died with COVID. Absolutely, it will happen, and it has happened. But those patients or those kids had other comorbidities that unfortunately were, the problems were triggered by that infection. It could have been triggered by another infection too. What I'm trying to say is that it will affect kids will transmit, but their cases will not be as severe as adults, and the number of deaths will be completely lower in percentage compared to the more the adults and the most vulnerable cohorts. But certainly they can transmit. Discussing about kids and COVID is extremely difficult. I have small little children, and it's very difficult even at home. Talking to my wife or discussing with my wife, what decisions do we take for them, and it's very hard because not every kid is in the same page protected. So those are decisions that have to be taken as a community. And nobody will be happy with any decision that is taken. Somebody will have to take decisions, will take some decisions for school, for system, for churches, and not everybody will be happy.
I took both of the shots, and I'm 77 years old, and it didn't affect me at all. I'm happy, and I do recommend the shots. Even when I was a child, we had shots, and we stood in line at school, and then, we had vaccines. when
There you
we were
go.
kids. And all my children lived, and I got some old ones,
There you go.
so I do recommend it.
I do recommend too. Thank you very much. Thank you very much for listening. Thank you very much for sticking with us. We will continue to watch this situation here in Central Alabama. Thank you to all the people that have come today.